In this video, we'll simplify heart failure, cover the must-know nursing priorities, and finish with a practice NCLEX question and full rationale. Let's get started. Heart failure is when the heart cannot pump enough blood to meet the body's needs. This can happen because the heart is weak or stiff or overloaded with fluid. There are two key types you'll see on exams: right-sided heart failure and left-sided heart failure. In right-sided heart failure, the right ventricle can't push blood into the lungs. The blood backs up into the systemic circulation. In left-sided heart failure, the left ventricle loses its ability to pump blood forward into the body. Blood then backs up into the lungs. In left-sided heart failure, blood backs up into the lungs, causing crackles in the lungs, dyspnea and orthopnea, which is shortness of breath when lying down, pulmonary edema, which shows as pink, frothy sputum, and be careful, this is a late red flag. Think left equals lungs. And recall that in right-sided heart failure, the blood backs up into the systemic circulation. This then leads to peripheral edema, so you may see swollen ankles and feet, jugular vein distension, ascites, which shows as fluid in the belly, hepatomegaly, which is enlarged liver. So for this one, think right equals rest of the body. Nursing management for heart failure focuses on reducing fluid overload and supporting cardiac output. Therefore, your nursing management will include these interventions: oxygen therapy as needed, diuretics like furosemide or Lasix, fluid and sodium restriction, and strict daily weights. Now it's time for our NCLEX-Style practice question. A client with chronic heart failure reports sudden weight gain of 3 pounds overnight, increased shortness of breath, and swelling in the ankles. Which nursing action is the priority? Option A, administer prescribed diuretic medication. Option B, place the client in high Fowler's position. Option C, restrict sodium intake at the next meal. Option D, notify the healthcare provider immediately. Let's pause here. Take a moment to think about your answer. Pause the video if you need more time. The correct answer is A, administer prescribed diuretic medication. Now let's look at why A is the answer. So, a sudden weight gain in heart failure means that there's an acute fluid overload. The priority is to remove excess fluid quickly, which is done by giving diuretics, hence why we're choosing A. In B, high Fowler's helps with breathing, but it does not treat the cause. C, sodium restriction, will help long term, but it won't fix the acute overload that you're seeing with this patient. And in D, notifying the provider may come after, but NCLEX wants the nurse's immediate action first. If this helped you, hit subscribe to Nurse Prep Central for weekly NCLEX reviews, Med-Surg practice questions, and quick nursing tips. See you in the next video where we'll cover COPD and oxygen therapy. Have a great day!